The state of Missouri put in place their process to pay for forensic exams for patients in 2008. So we started working on our program here in 2008. Actually, just to kind of give it a little bit of background, the Violence Against Women Act, one of the provisions of that was that in order to receive certain kinds of funding, every state had to put in place some sort of a process to pay for forensic exams so that the patients did not have to pay for forensic exams. So the state of Missouri put their process in place in 2008. We started working on our program then. We officially started the program April the 1st of 2009. So it's been going since then. And let's see, we're currently up to about 650 exams that we've done at this point. You have to be an RN or higher level advanced practice nurse, and then usually you take a 40-hour didactic training course and then a clinical training course. It varies somewhat about what institutions require for the clinical training. Our hospital requires that the nurses do, I think it's 15 pelvic exams under supervision of a practitioner or physician, and then also we require some courtroom observation so that they get the experience of seeing what it's like to testify in court. The standard recommendations are, not to eat or drink, not to shower, not to change clothes. They're certainly welcome to bring a change of clothes with them to the hospital. We do also have clothing. The Wyandotte Nation was wonderful in that they provided they donated 150 go bags for men and women in various sizes of clothing. So we have a clothing pantry in addition to that, and toiletries that they provided. So we can provide clothing for patients if they, have to give up their clothing as part of the evidence collection. But even if they have showered or they have eaten or drank, it's still okay. Just because they've done those things doesn't mean that we can't collect any evidence. Typically, if we have a patient, the first thing that we do is introduce ourselves. We explain what the program is, what the services that we offer are, and basically what the choices for the patient are. One of the most important things that we do for the patients is give them power back. Some people may not realize that sexual assault's not really about sex, it's about power and control. So we want to give patients back power and control over what choices they make and what happens. So we talk with them about the services that we offer. We make sure that they're safe, that they have a safe place to go. We provide them with a bedside advocate from Lafayette House if they want that service, aftercare information, if they want prophylactic treatment for just in case for sexually transmitted infection, pregnancy prevention, things like that. So we go and talk to them, introduce ourselves, explain the process to them, see what they're interested in, and of course if they need any medical treatment or want any medical treatment, we make sure that they have that, and then we explain how the process works and see what they want for us to do. If they want to make a report to law enforcement, we can help facilitate that for them. If they aren't sure if they want to make a report to law enforcement, we can actually collect evidence for them if they think they might want to report it later and store it for them. My advice would be to not be embarrassed. It's not their fault. I know sometimes, unfortunately, people encounter victim blaming, but we always want to emphasize for the patients that it's not their fault. It doesn't matter, where they were, if they were drinking, if, whatever the circumstances were. This was something that a person made a choice to do against them. This was not something that they wanted to happen to them. So it is not their fault.